is Yermi, and today we are going to talk about how the heart and ECG function. So we're going to start to talk about the heart. So we have this tube here. The top section is called the superior vena cava, and the bottom is the inferior vena cava. Once blood enters the tubes, it goes to the right atrium through the tricuspid valves. These are the tricuspid valves. So the reason why we have valves in our heart is because we don't want blood to go back. We want it to move forward so that our whole body can have blood. Once it goes through the tricuspid valve, then it goes to the right ventricle and through the pulmonary valve, and then to the pulmonary artery, and then to the lungs. That's what the right side does. And now we're going to talk about the left side. So the left side, we have pulmonary veins. These two are the pulmonary veins. Blood enters through there, and then it goes to the left atrium, through the mitral valve, to the left ventricle, and then it pushes the blood to the aorta valve, which is this section. And when it pushes it to the aorta valve, that's when the heart usually contracts. So then once it's past the aorta valve, it goes through the aorta and to the rest of your body. So that is how blood moves through the heart. Now we're going to talk about the signals of your heart. We have two types of signals. First of all, it's called the SA node, which is located at right here in the corner. Then we have the AV node, which is located here, towards the center. So once the SA node releases the signals, signals are only released in the top, which is the atriums. So SA node releases to the atriums, and then SA node triggers AV nodes. It triggers AV nodes so that it can release signals to the rest of the heart, the bottom of the heart. And that's when the heart contracts. Now we're going to talk about the ECG. So the ECG is usually used in hospitals. It is used to monitor your heart. So if the doctors see that something's funky with your heart, or it's not functioning right, that's where the ECG shows any problems or anything. So how the ECG works is, first, this is how it actually looks like. The P wave is a little bump. The QRS is a huge, call it a mountain, and then the T wave is a little bigger than the P wave. So the P wave is when the SA nodes activate. That's when the signals are released. And the QRS, that's when the heart contracts. And then the T wave is when the heart relaxes. Here are some heart sounds. I don't know if you have heard this, but you've put your ear to someone's chest, or maybe you've had the doctors to listen to your heart. You can hear the sound lump dump, and usually, yes, remind that lump is when the tricuspid and mitral valves close. So as a reminder, this is a tricuspid valve, and then this is the mitral valve. And when they close, that's when you can hear the sound lump. And as for the dump, that's when the pulmonary and artery valves close. So as a reminder, this is the pulmonary and aorta valve. Once they close, then that's when you can hear the sound dump. So next time you hear someone's heart, when you hear the sounds lump dump, try to imagine how the blood moves through the heart. It's kind of cool if you think about it. So that's that. And the reason why I think that learning about that knowing how the heart and ECG function is important is because having knowledge of how your body works, which could help you detect if something's wrong with your body. So I feel like that's important. That's it for today. Thank you for listening, and I hope you have a great day. Bye.